We have one of the partners Skyping in this morning. That is Dr. Premal Patel. Thank you so much for being with us.
Thank you so much for having me.
Dr. Patel, we've heard calls from Indigenous communities time and time again that they are underserved when it comes to access to services. Has that become even more evident during this pandemic? And tell us what you've decided to do about it.
Yeah, absolutely. Prior to the COVID pandemic, there's always been this issue of access to routine healthcare. And during the COVID pandemic, we've seen an exacerbation of this lack of access. And our goal of starting Sabe Wellness is to allow Indigenous communities, rural communities, to access timely physicians on their own schedule. One of the communities that we currently serve, Sapatoya Cree Nation, which is one of the communities that one of our co-founders is from, doctors would often come to the community, but they would sometimes be every week, every other week. And because of COVID restrictions, they're finding that less doctors are coming to the community. And so Sabe Wellness is able to provide virtual care to patients that require access.
So how are you hoping to grow this platform? Are you hoping more communities will get on board, that more people will hear the word? Tell us about your future plans for Sabe Wellness.
Yeah, absolutely. So our initial goals right now is to expand how many physicians we have on the platform. So we have several primary care physicians. We have specialists as well, such as myself, a urologist. We have psychiatry services, and we plan to expand the amount of physicians we have. Apart from that, we also want to expand the type of allied health professionals that we have, from lactation consultants to dietitians to occupational therapy, physiotherapy. So there is a number of plans that we have in place to try to expand what people can access.
During this pandemic, we have seen more and more services go online out of necessity, but are there benefits there? What are we learning about the benefits of virtual healthcare? Are there cost savings realistically?
Yeah, absolutely. It's a great question. So even from a perspective of even my own clinical practice, so I'm a urologist at the Health Science Center. I've been routinely using virtual care right now because of restrictions, but also it's quite effective. People are able to just step out of their office. They're able to do virtual care appointments at home. And so it actually serves as a purpose of identifying what are the issues that need to be addressed, what tests can I do before I actually see you in person. And then when I'm able to see you in person, we can actually make it a more efficient visit. And this even goes further to patients who live in further areas, right? So the cost of just travel to the healthcare region, the time spent, there's huge benefits of telemedicine or virtual care. And I believe that this will continue on after the pandemic.
And we'll look forward to hearing how this initiative grows. That is Dr. Patel Skyping. And quickly before we let you go, how do people access the platform? How do they find out more about Sabe Wellness?
Absolutely. So to access the platform, they need to visit our website. So www.sabewellness.ca. So SABE wellness.ca. And on there, if they have any questions or any comments to us, they can contact us directly.